For the past 14 months, she has been working with Project Step 1 on an honorary basis, focusing on teleconsultation and talking to a lot of COVID positive patients with special focus on emphasis on H1, HQ norms, doing a follow-up, expediting quick movement of patients who need immediate hospitalization, and promoting COVID recovery patients to come forward to donate plasma. Thank you so much, Dr. Amita, for joining us.
Thank you so much. Thank you very much for getting me on this platform and giving me this honor to try and, I shall try and do justice to whatever you ask me to the best of my ability.
The honor is completely ours. The honor is completely ours.
Thank you so much. And if I falter, do pardon me. It's too vast a subject, too humongous a bimari, a mahamari, a tsunami. So whatever we say is but from the experience of 14 months only.
Absolutely. No, I completely agree with you, but as much of information as we can spread. Prashant is the co-founder and CEO of Qure.AI. It's a startup that has been effectively using AI to make diagnostic imaging like X-ray and MRI affordable and accessible. Currently, the startup has been closely working with doctors, healthcare providers to ensure better access, diagnosis, and help lessen the burden of the healthcare infrastructure in every way possible. So today, thank you so much for joining us today, Prashant, and thank you for giving us your time.
Thanks for having me here. Honor to be here. Thank you, Sindhu.
Great. So today we're going to focus on access of information, access of healthcare, and correct information more than just information in Tier 2, Tier 3 cities. We see that that is a big challenge. So Dr. Amita, I would like to start with you. You know, the second wave, we've been talking before this, we started the panel on, you know, how it's actually really worse and reached our homes today. And it started affecting a lot of people, even in Tier 2, Tier 3 cities of India. So what steps can be taken to ensure that there is lesser misinformation in these areas? Because I think a doctor was telling me there's a lot of misinformation in these parts, and it's just completely impossible to reach the remotest corner with a country like ours, especially.
A difficult question. I shall try to the best of my ability. Now, 2-tier cities and 3-tier cities are smaller than the 1st-tier city, right? We all know that. For example, Ahmedabad, Kanpur, Chandigarh, Patna, Dehradun come in the 2-tier, and 3-tier is Madurai, Baroda, Nasik, Trichy, and others like them. So let us first discuss why all this has actually happened and what has spread the misinformation. So second wave actually started with effect from 14th of February. As we know, it spread at a very, very alarming speed. It was so alarming that a lot of cities spiked at 100 to 150%. And then you must also remember that Ratlam just 2 weeks ago had 500% of spike of cases. Yeah. An incorrigible, unsurmountable, unfathomable amount of spike. 55 districts out of the 17 states had almost 150% of spike. The spike was moving and gradually started moving from the 2 tiers to the 3 tiers, and from there to the semi-urban, the semi-rural, and finally it reached the rural areas as well. The worst hit was states and the cities of 2-tier, 3-tier actually were from Maharashtra, Punjab, Karnataka, Gujarat, and Tamil Nadu. Now, what was the reason why? We have to actually decipher, and then we come to the misapprehensions. The greater infectiousness, high amount of transmissibility, and partly also to a large amount by the new strains, the mutants, the 6 different varieties of strains which are now creating a ravage in our country. Laxity of preventive measures cannot be undone, and all the 6 variants cannot be absolutely ignored at all. Why and what actually really happened is what the next question should be and would be. There's fear of stalling of the vaccination. People did not want to get the vaccination done. There's lack of awareness for the vaccination. Multiple lockdowns, 1, 2, 3. The extension, the fear that is going to go beyond 3 months was another big fear. Once this was happening, the people, the migrant laborer thought, my God, ab hum aur phas jayenge. Na kaam, na dham, na paisa, na roti. Let's start going home. If you talk of Delhi and NCR, they made a beeline to the Kashmiri Gate bus adda. And from there, we have seen all the videos. They're very, very vivid in our memories. When they could not get the buses or the trains, they started walking. Walking. Many of them picked up fatalities. They succumbed. Many of them picked up the bug. And it is in this condition of being a carrier, they reached their semi-rural and rural areas. And that is how is a very important way that the bug virus now started transcendenting and going into the rural areas. People's apathy to follow precautions is another important reason why all these things happened. Then the harvest time began. At harvest time, people went out, helter-skelter, they have to do the harvest. Then the RT-PCR testing was another taboo. नहीं कराना, हमको कुछ नहीं है. और अगर करा लिया और positive आ गया, हमको कुछ नहीं है. That was another denial. A series of denials followed suit, and the cases went on increasing and spiking all over. First, नहीं कराना RT-PCR, करा लिया, we don't agree to it. अगर मान लिया, hospital जाओ, नहीं जाना, इलाज कराओ, नहीं कराना. It's totally a denial mode. And then to add to it, the 2-tier, 3-tier cities, the semi-rural and the rural areas, the shortage of hospital staff. Oxygen supply बहुत था ही नहीं. उसकी catering नहीं की गई थी. Medicines भी नहीं थी. यहाँ तक कि very sad to say, the morgues and the crematoriums were also overbrimming. क्या बोले? The surge just happened and carried on happening. So, और छोटी-छोटी बातें अगर बताएं, 2-tier, 3-tier cities की, किसी जगह पे मेडिकल कॉलेज में जगह ही नहीं थी, लोग ही नहीं थे, देखभाल करने वाले स्टाफ ही नहीं था. यहाँ तक कि नेगेटिव जो लोग थे, वही रिश्तेदार अपने पॉजिटिव पेशेंट्स की देखभाल कर रहे थे. बच्चे, कोई कहता था कि बच्चों को होता नहीं है. इस वेव में आके देखो, झांक के देखो, 2-tier, 3-tier में बच्चे बीमार पड़ रहे हैं. कितनी जगह ऑक्सीजन की कमी पड़ गई. कितनी जगह बिहार जैसे शहर में गंगा में बहते हुए कितनी लाशें दिखी. All this was total mayhem. It was very depressing. नैनीताल जैसी जगहों में, पहाड़ों में, गवर्नमेंट ने सोचा ही नहीं कि पहाड़ों में ये बीमारी आएगी. वहां तक बीमारी फैल गई. So once you think of all these things, you talk of the misapprehensions. बच्चों में लोगों ने कहा था कि नहीं फैलेगी, फर्स्ट वेव में नहीं फैली. अब बच्चों में बहुत आ गई. बच्चों को GIT सिम्टम्स हो गए, ब्रेथलेसनेस हो गया, डिस्निया हो गया, फीवर टूटता ही नहीं था. हॉस्पिटल में जाना पड़ा, एंटीवायरल लेना पड़ा. पूरी फैमिलीज चपेट में आ गई. ग्रैंडफादर, ग्रैंडमदर, पेरेंट्स एंड बच्चे. पीडियाट्रिक्स टू जीरियाट्रिक्स, जीरियाट्रिक्स टू पीडियाट्रिक्स. पूरा कुटुंब, पूरा परिवार, सबके सब मेंबर्स इस बीमारी के शिकार हो गए. पहले लंग डैमेज कम होता था, अब फर्स्ट वीक में ही लंग डैमेज शुरू हो गया. इसके अलावा साइकोलॉजिकल इफेक्ट बहुत ज्यादा हुआ. साइकोलॉजिकल इफेक्ट, इकोनॉमिकल इफेक्ट, फिजियोलॉजिकल इफेक्ट, पैथोलॉजिकल इफेक्ट, सब चीजों को देखते हुए फाइनेंशियल इफेक्ट एक विशियस सर्कल बन गया. साइकोलॉजिकल वायरस का जो फियर है वो बहुत कंटेजियस हो गया. ये एक विशियस सर्कल था, एक साथ दूसरा चीज लिपटी हुई थी और केसेस खत्म होने का नाम नहीं ले रहे थे. अब इकोनॉमिक इफेक्ट्स में अगर आप देखा जाए, जब लॉकडाउन हुआ, जितने लोगों बिजनेसमैन थे उनके बिजनेस सारे कम हो गए, खत्म हो गए, तबाह हो गए. खाने पाने के, रोटी पानी के लाले पड़े. Then what happened? Once it opened into open phase all over the country, that is the time when people only bought things which were required for the health. Luxury items की तो बात ही खत्म हो गई. People didn't have so much money. Earning capacity had gone down. So, misinformation इतनी ज्यादा बढ़ गई. उसको स्टेप्स को कर्व करने के लिए कुछ ना कुछ तो हर शहर में, हर गांव में लोगों ने लागू करने शुरू कर दिए. अब मिसइंफॉर्मेशन क्या होती है? मिसइंफॉर्मेशन मींस फेक इंफॉर्मेशन, इनकरेक्ट इंफॉर्मेशन, जिसको हम मिथ भी बोलते हैं. स्टेप्स इस इंटरनेट एरा में, व्हाट्सएप की इंडस्ट्री देख लो, मोर देन 400 मिलियन व्हाट्सएप यूजर्स हैं. इंटरनेट एरा है, फेसबुक है, ट्विटर है, इंस्टाग्राम है, क्या नहीं है. इस सब में किसी ने कहा ये एक बायो वेपन है, किसी ने कहा चाइना से आया है, किसी ने कहा बैट से पैदा हुआ है. जो कुछ भी कहा हो, हर जगह मेहम और टैंडम फैल गया. फेक न्यूज इतनी थी कि जब पता लगा कि 3 महीने से शायद ज्यादा लोग बढ़ जाएंगे, लोगों ने गांव में जाना शुरू कर दिया. लोग गांव गए, जैसे मैंने आपको पहले बताया, कितनी बुरी हालत हो गई. बीमारी शहरों से निकल के गांव में पहुंच गई. फेक न्यूज एक पब्लिक हेल्थ कंसर्न बन गया. मीडिया में वेब एक प्रोपेगेंडा है. There was more views than actual news, which was actually happening. Lack of clear distinction between the real and the false had to be clarified. So, एक पैनिक वर्ल्ड वाइड तो हुआ ही हुआ, देश में भी हुआ, और 2 tier 3 tier cities में naturally वहाँ भी हुआ. It took so many lives, so many casualties. Yeah. It became a myth menace. Time of blame game has gone. People call for solidarity came up. तो क्या steps लिए गए? कुछ ऐसे हुआ कि WhatsApp ग्रुप के जो एडमिन है उनको हिदायत दी गई, ध्यान रखो कोई उल्टी सीधा प्रचार ना करे इंफॉर्मेशन का. साइबर क्राइम ऑफिशियल्स दिन रात डबल काम करने लग गए to see that nothing untoward is happening. Things are happening, people are being cautioned. Strict regulation of the social media platforms was inculcated. We need a vaccination against the misinformation actually. Regulatory bodies misleading information को हटा के replace with accurate information जरूरी हो गया. Awareness campaigns शुरू हो गए. एक My Government Corona Help Desk initiate किया गया. India Fights Corona एक और initiate किया गया. घर बैठो इंडिया एक और शुरू किया गया. गवर्नमेंट ने एपिडेमिक डिस्ट्रिक्ट एक्ट भी शुरू किया और डिस्ट्रिक्ट मैनेजमेंट एक्ट भी लागू किया. कमिटी ऑफ पीस ने भी अपना काम शुरू किया. जहां जहां जरूरत पड़ी लोगों ने इम्प्रिजनमेंट और फियर ऑफ फाइन ऐसी चीजें भी लागू करी. इंट्रोडक्शन ऑफ इन ऐप इंफॉर्मेशन पॉलिसी पेज भी लागू किया गया. ये सब चीजें देखते हुए मिस इन्फॉर्मेशन को हमें बढ़ावा नहीं देना है. मिस इन्फॉर्मेशन को हर हाल में हमें रोकना है. जो भी गलत काम कर रहा है, गवर्नमेंट अपना काम कर रही है, पर हमारा भी फर्ज बनता है कि जो भी अगर कोई गलत बात बोल रहा है हमें उसको वहीं पर रोकथाम लगानी है. I think this is a lot about disinformation.
Yeah. No, thank you so much for giving us such an in-depth understanding of how it has actually transmitted to the smaller towns and cities. Thank you so much, Dr. Amita. And yeah, misinformation, as you said, we need a vaccine for misinformation now. But Prashant, you also have been working on this consistently for the past 2 years. Qure has been working, building products. Now you're working closely with teleconsultation and the Telegram groups and WhatsApp groups and all of that. So tell us about the work that you've been doing and what is your understanding of what's happening on ground?
Thanks, Sindhu. So we have been, Qure, we have been doing AI interpretations of X-rays and CT scans for the last 5-6 years. So we have been working in the AI, we have been applying AI to the medical imaging space for a long time now. And when COVID came about last year, we had an X-ray solution which could detect about 30 findings from the X-ray. So everything from consolidation to opacities, multiple kinds of opacities and so on. And what we built last year was we basically built a layer on top of that X-ray AI, which could basically create a score for COVID based upon the X-ray. You're looking for opacities on both sides of the lungs, so bilateral opacities. You're looking for opacities on the lower parts of the lungs. So opacity is basically a white patch in the X-ray, basically, right? So you're looking for abnormalities which are in on the X-ray and on which are indicative of COVID. And based upon that, you can do two things. You can basically identify a risk of high, medium, or low risk of COVID, or may also call it no risk of COVID. And what we can also do is we can mark out the regions where the pneumonia is present, the COVID pneumonia is present, and you can measure progression of disease on the X-ray. So what happened? Last year, of course, when COVID started, when the first wave came, right, it didn't hit us so badly. But the reality was that in India, at that time, in Mumbai, for example, the testing was very limited. I remember early days of COVID, the number of tests in Mumbai, RT-PCR tests in Mumbai was like 4,000 a day. And that's a very small number for a population of about 17, 18 million people. And so you could not RT-PCR test everybody. And that is where the X-ray AI became very useful, because the X-ray AI could serve as a triage for RT-PCR. Somebody who's coming in with symptoms, you do a X-ray, and based upon the X-ray, you would then see whether to do an RT-PCR test or not. And let's say I have COVID, I have about 10 family members or 10 people that I've been in contact with. Now those people, again, you do an X-ray, and the X-ray can serve as a filter to see if you should do a RT-PCR test. And the other way that this X-ray and the technology that we had built out was useful is in measuring the progression of COVID. So as patients go through COVID, their lung infections increase and then decrease over time. And so we were actually, we did a study with Harvard Medical School they evaluated this technology, found that the X-ray score that we create is highly indicative of survival of a COVID patient. And so there are multiple studies. There was a study done by an Italian hospital also, which came up with the same conclusion. So basically, the two use cases was to filter out, basically create a triage for RT-PCR testing, and to measure progression of COVID disease in patients. And over time, what happened is, just like Mumbai, of course, the number of COVID RT-PCR tests increased. But there, I mean, what we found is that the value of this kind of technology was in some of the rural parts of the city, rural parts of the country, where access was very limited. You have an X-ray machine, but you don't have a radiologist available to read the X-ray. So we are able to help them read that X-ray, help them interpret COVID on an X-ray within a minute. I mean, as soon as the X-ray is taken, within a minute, we can send the results to the mobile phone. And that is the use case we found. That is, we deployed in so many sites. We deployed in so many rural sites to detect COVID. And so that was another sort of expansion of a solution between the first and the second wave, right? From the first wave to, as it spread to rural India, we also started deploying in rural India. And we also, in the meantime, we also built out a solution which was basically for quarantined people. So we have an AI chatbot which can chat with you on WhatsApp, and which can see how you are responding to therapy, how you are, so whether your symptoms are getting worse or not, right? So for example, you are quarantined at home, and maybe your symptoms are getting worse, you need to go to the hospital, and the hospital or the government does not know how you are doing, right? So this technology will basically chat with you on a daily basis. It will ask your symptoms, ask what are the risk groups you might be in. Initially, it might ask about risk groups, whether you have diabetes or heart failure, any of those conditions. And then it will on a daily basis monitor symptoms to make sure that people who need to be hospitalized or people who need to be tested are then brought in for testing into the hospitals. So that was again a chatbot that we developed. Now coming to the second wave, what we saw was that the couple of challenges, right? With the new variants, RT-PCR tests provided a lot of false negatives. So high level of false negatives in RT-PCR. Again, with rural India, lack of RT-PCR testing. And nowadays, I mean, even in the last month or so, even in the big cities, RT-PCR testing was very, very hard, because you take a test today, you get results in 5 days. COVID is such a disease, 5 days you are here or there. I mean, you're basically either very serious or you're already much better, right? And so that's not enough. I mean, getting a RT-PCR result in 3 to 5 days is not enough. You have to act quickly. So again, at that time, X-ray AI and the AI that we brought in became very useful. So that is something that a lot of people started using. And then recently, I mean, we sort of, one of the things that was happening throughout this was that a lot of people were sending me X-rays on my phone, that can you give me an interpretation of AI? And so many people, not only me, but other people in the organization also, we said, can we create a bot so that people can just send an X-ray to the bot and it can send results? So we created a Telegram bot. And why Telegram over WhatsApp is because Telegram, the quality of the pictures is better. WhatsApp has a very high level of compression. So compress an X-ray, you cannot see nodules, you cannot see some small lesions. So we didn't want to make that error, I mean, create a false negative. So we released that bot on Telegram. And it's not meant for patients, because finally we don't want this to go to patients directly. It is meant as a second read for a physician or a general practitioner or a health worker, right? So they are reading X-rays and they want a second opinion. They can just send the X-ray to us and we can provide an interpretation. Again, not meant for radiologists, because radiologists will obviously read X-rays and they know how to read X-rays. But there are so many places where radiologists are not available, and it's very simple. You can just take a picture, send it onto the Telegram bot, comes back with result in about 30 seconds, 40 seconds, and that's it. I mean, it gives you a full report, gives you COVID, whether there is COVID or not, what is the COVID risk score, high, medium, low. It marks out the region where there is COVID. It can also quantify how much of the infection is there. Another thing that we launched along with this was that the chatbot that we spoke about, the AI chatbot, which was chatting with people at quarantine at home, we actually repurposed that to do vaccine adverse event monitoring, because we're working with WHO now, and we'll be announcing some things around that, working with WHO, where so many countries want to measure adverse events, they want to track adverse events, and there is no way to do that easily, right? And because a lot of times adverse events are self-reported. I mean, I might report something, somebody else may not report. And so you're not tracking everybody who got a vaccine. And this chatbot is a very good way to track everybody. So you send a message to everybody asking them if they have any adverse events. You keep on tracking them on a daily basis through a, let's say, 3-week period or maybe month period or 2-month period. can track using this chatbot. So that is what we are doing now. We are doing a lot of adverse event monitoring using that chatbot. So that and the X-ray AI, which is now available, obviously directly integrated with the X-ray system, which is our primary way of integration, but also now available on a Telegram message. You can just send a Telegram message to our bot and it can send you results back. So that is what we're doing now.
Great. That's a lot. That's a very compressed answer for a lot of work that you're doing, Prashant.
A lot of work, yes.
Lot of work. So great. Kudos to people like you. Actually, kudos to all of you for all the work that's being done. Getting back to misinformation, Dr. Amita, in your consultations that you've had and conversations that you've had, and I know I'm part of the Project Step 1 WhatsApp group as well. There are a lot of questions and queries and everything that comes in, and there are multiple groups. Can you give us some examples of the misinformation that you have seen, and how is telemedicine working to combat that?
See some examples of misinformation. Misinformation का simple नाम है myth, वहम, अफवाह. इसको हम हिंदी में बोल सकते हैं. तो सबसे पहले तो लोग कहते हैं, shall I speak in Hindi or you want me to carry on in English?
Please, Hindi is fine. Hindi
Okay.
is absolutely
You see,
fine.
because when I talk and triage to people, it has to be more of it in Hindi. So I normally get down to speaking in Hindi also.
Absolutely.
So I was telling you about alcohol, sanitization, and chlorine, hypochlorite, etc. People ask me, does it kill the virus? It doesn't. It just doesn't kill the virus. On the contrary, they used to say 60% से ऊपर होना चाहिए. जहाँ 60 से 65 किया, हाथों की एलर्जीज भी शुरू हो जाती थी. And it can in fact harm the skin and also the eyes. So one has to be careful. They used to say corona is only a disease of the adults. You tell me, is it? Now, it's not. They used to say बच्चों में कुछ नहीं होता. अब आप देख सकते हैं second wave में बच्चों को कितना कुछ हो रहा है. It's like flu. Yes, to a large extent, it's like flu. खांसी जुकाम नजला गले में तकलीफ खराश, yes, but flu में pneumonia नहीं होता. फ्लू में कॉम्प्लिकेशन ज्यादा नहीं होते हैं. फ्लू में मोर्टेलिटी नहीं होती, इसमें होती है. There's a difference. वो समझाना पड़ता है. Everyone who picks up COVID-19 मर जाता है. नहीं मरता है. मोर्टेलिटी बहुत कम है. फेस मास्क पहनने से कोरोना होता ही नहीं, ये हमने सुना है. अरे भाई, अब तो डबल मास्क ट्रिपल मास्क का आ गया है रिवाज नहीं, ऑर्डर आ गया है. फर्स्ट मास्क से पहनने से सिर्फ 40% मिलता है तकरीबन. सेकंड मास्क से 85% प्रोटेक्शन मिल सकता है. दैट्स इट, नॉट इवन 95. लोग कहते हैं हेयर ड्रायर से वायरस मर जाता है. नहीं मरता.
This is new. This is new.
Yes. Rinsing the nose with saline protects us from COVID-19. कुछ नहीं करता. Protection with gargling नहीं करता है. कोई एविडेंस नहीं है ऐसा. हम अपने गले को बचाने के लिए, हम अपने गले में राहत पहुंचाने के लिए गार्गलिंग करते हैं. फिर एंटीबायोटिक्स कोरोना वायरस को मार देता है. अरे भाई, वो बायोटिक है, वो बैक्टीरिया को मारता है, वायरस को नहीं मारता. थर्मल स्कैनर लगाने से वायरस मर जाता है. वो सिर्फ टेम्परेचर बता रहा है, वो थर्मोमीटर है. बुखार किसी और वजह से भी होगा, कोरोना को नहीं मारता. गार्लिक से कोरोना नहीं होता है. गार्लिक से गले में राहत मिलती है. कुछ बैक्टीरिया कुछ हद तक थम सकते हैं, पर उससे कोई कोरोना खत्म हो जाएगा नहीं, ऐसा नहीं होता. I've written down a few points क्योंकि ये मिथ्स बहुत सारे हैं. होम रेमेडीज से कोरोना से राहत मिलती है. कोरोना के टाइम पर होम रेमेडीज आराम देती हैं, इम्यूनिटी बढ़ाने में सहायता करती हैं. They help us to fight off the depression of the immunity by giving us a little immunity. That's it. They do not protect us from the virus. They increase a bit, support us to increase the immunity. You can catch COVID-19 by eating Chinese food. China से आया ना, इसलिए Chinese food खाने से हो जाता है.
This one.
ऐसा नहीं है. फ्लू की वैक्सीन है, निमोनिया की वैक्सीन है. It will protect us. We don't need this particular vaccine जो आजकल आ गई है, कोविशील्ड और कोवैक्सीन. नहीं, ऐसा नहीं है. ये नया तरह का वायरस है, इसके लिए नए तरह की वैक्सीन जरूरत थी, इसलिए तो पूरे दुनिया में हलचल मची हुई है, वैक्सीन वैक्सीन वैक्सीन। अगर उससे हो रहा होता काम तो इतना भगदड़ क्यों मचती? ड्रिंकिंग अल्कोहल,
There is a lot of personal motivation here for people.
इट रिड्यूसेस द रिस्क कंप्लीटली। ऐसा नहीं है, अल्कोहल सिर्फ स्किन को डिसइंफेक्ट करता है, इसका कोई रोल नहीं है इनसाइड द बॉडी। आउटसाइड द बॉडी स्किन में कर सकता है, इनसाइड द बॉडी तो आपके मूड को टिटिलेट करेगा, आपको एसिडिटी दे देगा, आपको अल्कोहलिक प्रॉब्लम्स दे सकता है, लेकिन कोरोना में कुछ नहीं कर सकता। ऑन द कॉन्ट्ररी, इफ यू आर अ हैबिचुअल ड्रिंकर, it can reduce your immunity, and therefore if you get the virus, then it can lead to more complications. So please observe constraint. स्विमिंग पूल में जाने से कोरोना हो जाता है, पानी से अभी कोई ऐसा कोई उदाहरण नहीं मिला है हमें। हाँ, कॉन्टैक्ट्स और फोमाइट से वहां पे बिगड़ सकती है हालत, इसीलिए क्यों जाना स्विमिंग पूल में। विटामिन सी सप्लीमेंट खाने से कोरोना ही नहीं होता। दोस्तों, कोरोना अपनी जगह है, विटामिन सी की वैल्यू अंडरमाइन नहीं कर सकते। विटामिन सी एक बहुत पोटेंट एंटीऑक्सीडेंट है, वो कुछ हार्मोन्स को सिंथेसाइज करवाता है, फ्री रेडिकल डैमेजेस को हमारे खत्म करता है, और कनेक्टिव टिश्यूज को सील ऑफ करता है, सपोर्ट करता है हमारी बॉडी को। इसलिए विटामिन सी तो हाई डोजेस में जरूर लेना चाहिए। ये बड़े शहरों की, बड़े लोगों की, बड़ी बिल्डिंग में रहने वाली प्रॉब्लम है। ये बीमारी हम लोगों में घरों में, छोटे घरों में नहीं आई, आ गई ना छोटे घरों में, सब जगह आ गई है, चप्पा चप्पा में आ गई है। आप लापरवाह होके तो देखो, थोड़ा और लापरवाह हो जाओ। अब देखो सेकेंड वेव आया है, कंट्रोल नहीं किया, तैयार है थर्ड वेव आने के लिए। इंडियंस में बहुत इम्यूनिटी है, नहीं होता है। इंडिया में तो भरा पड़ा है इस वक्त। 5G टावर से नहीं आता है, 5G टावर से आता है। अरे भाई, मोबाइल नेटवर्क और रेडियो से नहीं आता है। 5G तो अभी शुरू ही नहीं हुआ, अभी तो उसकी आनी बाकी है, तो इसकी बातों को भूल जाओ। ये तो मैंने कुछ उदाहरण दिए हैं अफवाहों के। अब टेलीमेडिसिन का क्या रोल है? टेलीमेडिसिन जब मैंने डिजास्टर मैनेजमेंट का कोर्स किया था, that is the time it was my thesis project also. It was very rudimentary at that time. We used to talk about telemedicine, going to remote villages where one would train even the nursing orderlies to take the photographs and send the photographs to the higher centers. That was as far it was then, about 12, 13 years ago. But besides the preventive health checkup, the pre-COVID counseling, the incoming calls, the national health helpline which we have, the COVID positive cases which we triage, the post-COVID cases which we manage, the mental health groups which we have got, all these are part and parcel of the telemedicine platform, which we are now in our country. We have all taken it up on a very huge scale, a very massive scale of digital health services has sprung up. I would say this is the plus point of the COVID which has happened here. अगर ये नहीं होता, कभी किसी ने सुना था कि टेलीमेडिसिन में काम चल रहा है, would people agree to it कि भाई फोटो देख के आदमी को ट्रीटमेंट कर रहा है? तो अब मिथ्स जो है, उनको टेलीमेडिसिन का क्या रोल मिला, कैसे हमने उनको सॉल्व किया? As such, we have the facility of incoming calls. People call us. When they call us, or when we triage the patients, is the only time we can actually listen to them. So we need to have a very patient hearing with them. We need to listen to their woes, listen to their dilemmas. We have to address their mood and behavioral changes. We have to break the spiral of apprehensions. We have to allay their fears, provide them accurate, correct, solid information. So we have to destigmatize the illness. I've written a lot of Ds. We have to dispel despair, dismay, depression, dejection, and delusion. And finally, we have to do triaging, follow up cases of triaging, vaccination motivation karte hain hum log. We hold their hand, and when they ask us, haldi se corona mar jayega, that is the time, haldi hi nahi, baki sab cheezon ke baare mein bhi हमें बताना चाहिए, और मैं कम से कम जरूर बताती हूँ. I take extra time to talk to my patients because I feel a stitch in time saves 9. अगर एक को बताऊंगी अच्छी तरह से, तो वो 4 को बताएगी, 4 14 को बताएंगे, 14 414 को बताएंगे. इसीलिए हमें मिस एप्रीहेंशंस को खत्म करना है, किसी भी तरह से उनको कैप करना. That is how we have to do all this with the mental health counseling. That's it.
Thank you so much. Thank you for telling us some of the myths. Some of these were completely new for me as well. Hair dryer, especially, was completely new. But yeah,
There are
thank you
quite a
so
few more.
much.
There's paucity of time also.
Prashant, I want to understand from you. You're doing something that can help reduce the burden on the current healthcare systems. What can be done? What are the challenges doctors are facing? The last conversation I had with someone, everyone was like, there's a lot of panic. People are stocking up concentrators, stocking up cylinders. All of that is happening right now. So, on ground, what challenges do you see that hospitals and doctors face, and how can we reduce the burden?
See, I think Dr. Amita spoke about a lot of the challenges, right? There is a lot of misinformation. People are taking drugs unnecessarily. I mean, I remember about a month ago, remdesivir was not available anywhere. I mean, and it works for a very small percentage. I'm not a doctor myself. I'm just talking about this from hearing other people speak, right? But my understanding is that it works for a very small percentage of the population of people who are sick, I think, early in the disease and so on, right? And the unfortunate part is, I mean, you're reading articles nowadays where people are going to doctors and saying that, why don't you give me remdesivir? Why don't you give me tocilizumab and all the others, right? And people start taking these drugs over the counter. I mean, imagine you're taking dexamethasone or some of these really strong steroids over the counter, and people are starting to take inhalers because that is what is the advice they're getting, right? So I think, it's a lot of misinformation. And I know a lot of my friends, a lot of people that I know have bought oxygen concentrators at home, and because their parents live with them, families live with them, and they feel like it can help them, right? So but the point is that the more somebody stocks up on things, the less is available for the rest of the community, less is available for hospitals and so on. So I think it's a matter of two things. One is that the public trust in healthcare system in India is very low, right? I think that is one issue, that we don't believe that the healthcare system can help us. And so we feel that we have to do it ourselves. And that is why a lot of people feel like, okay, they have to arrange for remdesivir. They will arrange. I mean, even people, I mean, I have helped so many people get that arranged through my colleague, through my friends and colleagues, right? And I've told that, see, it may not be useful. You might think about whether you want to get this drug or not. First of all, think about that even before you try to source it. But then people want to source it. People feel like, okay, if that is available, then if something goes for the worse, I mean, something moves towards the worse, then that drug is at least available. So you have that option with you. You have the option to have a concentrator with you. If you have it, you have already bought it, right? So I think that is, people are making sure that in case things go bad, they are prepared. And that is where I think the challenges are, because the trust is very low. And now that, of course, the number of cases is going down, I think the stress on the system is going down. Of course, I mean, from our perspective, from Qure perspective, we are not solving all these challenges. We are solving only one challenge, which is around the interpretation of X-rays and the vaccine monitoring, where X-ray interpretation, what we are able to solve is that lots of load on doctors to interpret X-rays, and especially CTs and X-rays are common imaging modalities, especially as you're looking at progression of COVID for a patient. ICU X-rays, you go into the hospital, you get an X-ray. So that interpretation is something which we are helping with by automating that interpretation. But I mean, obviously, I mean, to do all of the things that are there, I think the most important thing is for the country, a lot of people to stay home and to make sure that this is not spreading to a point where the system gets clogged. And
Yeah.
the system was clogged about a month ago, but now indications seem to be that it is getting unclogged. There are beds available. There is
Mm.
oxygen available. So I think that all bodes well for the future, and we have to continue this. And like Dr. Amita said, try to get more and more people vaccinated. I mean, I was looking at Israel data, and there apparently 60% of people are vaccinated, and so I
Yeah.
mean, they have basically, I mean, solved this, right? And it's a very small population, about 8 million people. We are so much bigger than that, right? So
Yeah.
we are 1,000 times maybe. I mean, or not 1,000 times, but yeah, it's at least 150 times of what that size is. So we have to also get people vaccinated. People have to be also open to getting vaccinations, and
Yeah.
that's again some
Yeah.
myths around vaccination that is going around, which we have to solve for. So I think there is a long way to go, but I also feel that the positive thing is that I mean, last wave, first wave, India actually did really well. I mean, compared to a lot of other countries, India was really solid. We had a very strong lockdown. We came out of it very strong economically. From a health perspective, number of deaths per thousand population was much lower than anybody else, right? Second wave has hit us pretty badly, but I think if we are prepared and we do the right things, both at a sort of policy level as well as at an individual level, I think we'll come out, and hopefully the third wave and others, we are prepared for it, and don't they don't affect us as badly as the second wave.
You've already answered my next question, Prashant. But before I come to you again, vaccination is one very, very important conversation everyone is having. And as you said, world over, it's an important aspect of, and I think there's no other solution other than getting vaccinated. India also has an 18 to 44 bracket, which is sometimes on, which is sometimes off in states. It depends on the availability. What I want to understand is many people are still concerned about the vaccination for different reasons. What is your suggestion and advice to them, Dr. Amita?
Yes, लगाना है, लगाना ही पड़ेगा. By hook or by crook. ऐसे नहीं तो ऐसे पकड़ के लगाना पड़ेगा. That is the nutshell. Now, पहले phase में 65 and above था, फिर 45 तक आ गया. अब 18 to 44 वाला age group है, जिसमें आप सब आते हो. मेरे बच्चे भी आते हैं. So, number of strategies have been put forward. We know that. The think tank is burning the midnight oil for last so many months, trying to devise the proper foolproof methodology, जो नहीं मिल रहा है for so many reasons known to all of us. I'm going to suggest from my myopic standpoint, what should be done. See, there are lots of things at the macrosomal level. The government, the prime minister, everybody is doing everything possible. They're devising methodologies. A lot of people refuting what they're saying and doing. I'm not going to get into that. What I want to talk about is we need a government subsidy. Free market for vaccination for all. Sensible way is to acquire it with proper pricing. Maybe make it free for the entirely poor and the below poverty line and the lower income groups. Maybe marginally subsidize it for other people who can afford to pay it. Some countries, if you please, I was going through it a couple of days ago, are offering beer and donuts as an incentive. That is Ohio. Some countries are giving $100 for every person who comes. $200. They've told cab drivers, whomever people you bring, we'll give you $50. So cash incentive works. It works in India as well. I mean, that we know it very well. So it is for the government to decide. I'm just putting things forward, whatever I've understood in my brain. I leave it to the strategists to think it out. Regarding the manufacturing, the supply chain, the manpower at every stage, the finances, and the import if required. पहले तो हम लोग export कर रहे थे. अब import करना है तो वो भी properly करो और जल्दी करो. That's what I have to say. Now, a very senior gentleman, he said, I'm going to leave no stone unturned till all are vaccinated. So why not think out of the box? We all know the polio vaccination drive happened. It took years to happen, but today it's eradicated. The system is in place. We know what has to be done. Uske baare mein sochna hi nahi hai. Replicate the same program of polio vaccination drive. We know all that is required in that. Only resources have to be mobilized. The finances have to be mobilized. The manpower has to be mobilized. But system is known. It's a proven system. Door-to-door campaign. Similar to the battery of people. When election होने वाला होता है, कैसे 5-6 लोग आपके घर में आते हैं 15-20 दिन, महीना, 1.5 महीना पहले, आपकी पर्ची काट के देते हैं आपको. आपके घर में कितने मेंबर हैं, पूरी फैमिली की डिटेल लेते हैं. अब करो ना यही सिस्टम. Get a battery of people. As it happens in the pre-election phase, let them come. So you have to envisage and create. A micro mini teams have to be formed. This is another option I'm giving. One is polio wala. Second is house to house. House to house में मैं बता रही हूँ अपनी तरफ से मेरे दिमाग से how to work on it. Every colony, I repeat, 4 to 5 members की team जा सकती है. उसमें एक nurse या nursing orderly, एक multi-purpose worker और एक guy जो वो मशीन लेके जाते हैं, जैसे बिजली का मीटर देखते हैं, वो लेके जाओ। अब कोविन ऐप की जरूरत नहीं होनी चाहिए मेरे हिसाब से। कोविन ऐप पूरे देश में लगाया, held up all the time, getting held up. So you go to the person's house, register करो आधार कार्ड, मेंबर सारे आ जाएंगे उधर सामने. When they come, you register, you see the BP, see the temperature, take the history, and give the jab. You give the jab. The doctor is sitting either in the community center, the doctor is sitting either in the gurdwara or in the mandir or in the club of the colony. Why do people have to get a jab and get a place in Max Patparganj? I'm living in Defense Colony. I'm getting a slot by Coven app in Patparganj. Why should I go all the way there? हर कॉलोनी को हिदायत दी जाए कि अपनी कॉलोनी में सारे नागरिकों को, सारे सिटीजन्स को वहीं पर जॉब मिलना चाहिए, किसी को जाने की जरूरत ही नहीं। जब किसी को जाने की जरूरत नहीं पड़ेगी तो वो ट्रैवल नहीं करेंगे। और हर कॉलोनी को एक टाइम लिमिट मिल जाना चाहिए कि फर्स्ट वीक में हम आपकी कॉलोनी में, डिफेंस कॉलोनी में आई लिव, वहां आएंगे। जब डिफेंस कॉलोनी में आएंगे तो डिफेंस कॉलोनी के लोगों को RWA वालों की तरफ से कोऑपरेशन के साथ बता दिया जाएगा, ए ब्लॉक में मंडे को आएंगे, बी ब्लॉक में ट्यूसडे को आएंगे, सी ब्लॉक में वेडनेसडे को आएंगे, लाइकवाइज। Once the people come like this, every member of the house will not go to work. If we know that on Monday in Defense Colony, D block where I live, people are going to come, एक दिन अगर लोग काम पे नहीं जाएंगे तो कोई फर्क नहीं पड़ने वाला। जो डॉक्टर्स यहाँ पे रहते हैं, जो A ब्लॉक में रहते हैं, D ब्लॉक में रहते हैं, उस दिन गवर्नमेंट की तरफ से हिदायत होनी चाहिए, वो डॉक्टर ड्यूटी अपनी ही कॉलोनी में देगा, वो वहां मंदिर में कम्युनिटी सेंटर में बैठेगा, उसको तनख्वाह और छुट्टी और अटेंडेंस उसके ऑफिस से मिलेगी जहां वो काम करता है। देखो, वी हैव टू थिंक आउट ऑफ द बॉक्स। यू नीड अ डॉक्टर समटाइम्स। एक पुलिस वैन खड़ी कर दो, एक एम्बुलेंस खड़ी कर दो, 4 या 5 लोगों की बॉडी बना दो कॉलोनी में। इस तरह से हर कॉलोनी में पूरा, अरे मैक्रोस्कोपिक लेवल की प्लानिंग करते हो, माइक्रोस्कोपिक भी करके देखो, मायोपिक भी करके देखो। जब लोग अपने इलेक्शन के लिए आ सकते हैं आपके घर में, इस काम के लिए भी आ सकते हैं, सोच के देखो। सो attendance should be given to the person. He should not have the fear, मेरी attendance का क्या होगा, मेरी नौकरी का क्या होगा, उसको मिलेगी। जिसका जॉब मिलेगा उसको एक दिन की छुट्टी भी मिलेगी। The doctor living in the colony के बारे में मैंने आपको कवर करके बता ही दिया है। इस तरह से अगर दिल्ली को देखा जाए तो उसके साथ 4-5 जोन है, नॉर्थ, साउथ, ईस्ट, वेस्ट। उसी हिसाब से हर जोन का जो प्राध्यापक है, जो उनके काउंसिलर्स हैं, जो उनके MPs हैं, उनको ऑर्डर आने चाहिए। They should transcend the entire information to each colony. Each colony has a secretary of the RWA. They should work it out like that. Just think about it. I'm very sure it will work in the entire country. Right. But it needs to be thought about it. It needs to be done at a microscopic level. जब उनके घर में पहुंच जाए, उनकी कॉलोनी में आ जाए, एम्बुलेंस वहां तैयार खड़ी है, डॉक्टर को कहीं जाने की जरूरत नहीं है। एक कॉलोनी में इस वक्त किसी भी कॉलोनी में 20-25 डॉक्टर तो होते ही हैं। हर एक को घर में नहीं बैठना है। जिस कॉलोनी के इनॉकुलेशन हो रही है, उसी कॉलोनी के लोगों को रुकना चाहिए। As all details हैं, we can work on them. So what I have to just say is, no COVID app की registration की पागलपंती में नहीं पड़ना चाहिए। वहां जाओ, वहीं कराओ और अपने घर जाओ। Stay in the colony, get your jab in your colony. You will get to know the team is coming. You should get the attendance of your place of work on the day of your jab. Doctors residing in the colony, मैंने लिख के पॉइंट्स रखे हुए थे आपको समझाने के लिए, और मैंने बोल दिया सब कुछ। So leave no colony, no tall building, no multi-level building unturned. Multi-level buildings में तो और भी आसान है, नीचे बैठो सब लोग, एक करके सबको बुलाओ, जैम लगाओ, भेजो, डॉक्टर खड़ा है वहां पे बाहर। That's it. Micro-level planning is required. That is my way of solving the problem. If you ask me my suggestion, that's my suggestion. Even the Mint today was talking a lot on these lines. Yeah. I just happened to read it. In fact, my husband underlined and showed me a few points. That's there. Then we can talk of vaccine hesitancy if you want to know.
Yeah, I want to understand on that as well. Vaccine hesitancy, a bit on that. I think it's reducing now, much reducing. People are no longer.
People are now coming forward.
People are now starting to come forward.
Yes. Vaccine is the biggest weapon we have today. We have no treatment, no injections. ये सब remdesivir, tocilizumab, नए आ रहे हैं, cocktail. Nothing is proven as yet.
Yeah.
Nothing is proven as yet. So we know vaccine काम करेगा. अगर वैक्सीन के लगाने के बाद भी कोविड हो रहा है तो उसका लेवल कम है, ज्यादा नहीं है। अगर लोग कह रहे हैं कि 2-4 लोग मर गए, अरे वो मरे इसलिए कि उनके पास कोमॉर्बिडिटीज थी, उनके अंदर और भी अंडरलाइंग फैक्टर्स थे, कोविड वैक्सीन से नहीं मरे थे। एक दो अनटुवर्ड रिएक्शन तो हर जगह होती हैं. कितनी बार रोटियां बनाती हूँ, एक आध बार रोटी तो मेरी भी खराब बन जाती है. So that is about that. Now, how many people get side effects is another question. A lot of people ask. साइड इफेक्ट क्या होगा? जहां इंजेक्शन लगाओगे वहां रेडनेस, सोरनेस, हल्का सा लंप बन जाएगा. कोल्ड पैक लगा लो बर्फ से. उसके बाद बहुत तकलीफ है, बहुत लेथार्जी हो रही है, बहुत पेन हो रहा है, रन डाउन फीलिंग हो रही है, लेट जाओ, टीवी देखो, गाने सुनो, व्हाट्सएप का इंडस्ट्री में बैठ जाओ, उसके अपना करते रहो. एक अच्छा पैरासिटामोल खा लो, अच्छी खुराक खा के जाओ, take a hearty breakfast, go for your jab. If you have an allergic tendency, take an anti-allergic and then go for the jab. Come back, again have another hearty lunch. Even if you're dieting that day, don't diet. You need extra nourishment. Carbs will give you instant energy. चीजों से बाद में proteins, I always recommend high protein diet from my wellness industry factor. But on the day of the jab, take a high carb diet. It gives you instant energy. And then what all can I say? Which vaccine is better, if you want to know? All are better. Nobody is giving you 100% efficacy. All are giving between 62 to 65 to 70 to 85. But जो मिल जाए वो लगवा लो दोस्तों. इतनी जल्दी से ये वैक्सीन तैयार की गई है, कोई एक भी आदमी 100% क्लियर है नहीं बोलेगा. 2-3 साल बाद इतने लोगों ने रिसर्च कर ली होगी, तब पता लगेगा कौन सी एक्चुअली इफेक्टिव थी और कितने परसेंटेज में थी. So that is a few things I can say. Will it cause infertility? कुछ लोगों ने पूछा. अरे भाई, infertility कहाँ से आ गई? एंटीबॉडी इतनी बढ़ेंगी, वो फर्टाइल हो जाएगी. Right? Then a lot of people question ask. They ask, अगर RT-PCR करवाया था, पहला जैब करवाया, पॉजिटिव हो गया तो अब क्या कराएं? 90 दिन बाद कराओ. आजकल तो वैसे भी 84 डेज तक का आ गया है रूल. हमारे टाइम पे था 4 to 6 weeks. अब क्यों 84 डेज का आया है? ये तो let us leave it to the people to think about it. A lot of things and a lot of theories are being propounded. We won't get into that. Pregnant women, अभी इसके बारे में क्वेश्चन आ रहा है. Lactating women को अलाउ कर दिया गया है वैक्सीन लगाने के लिए. वैक्सीन इज नॉट नेसेसरी, कुछ लोग कहते हैं. भैया मत लगाओ, मर्जी आपकी. हिस्ट्री ऑफ पीपल इज देयर बिफोर यू. किसी को हार्ट अटैक हो रखा है, किसी को एड्स है, किसी को और ज्यादा तकलीफ है, इम्यूनो कॉम्प्रोमाइज है, लगाए कि ना लगाए, ऐसे लोगों को तो जरूर लगाना चाहिए. जरूर लगाना चाहिए ऐसे लोगों को. उनकी डायबिटीज है, उनका हाइपरटेंशन है, उनको कोमॉर्बिडिटी है, they must get the jab as soon as possible. Don't delay it. People like me, nice and obese, we have to take care of our health. The factors are that if you are having some lifestyle disease, such a patient cannot ignore not getting it done. You must get the jab as early as possible. And then, of course, reduction in weight. Pranayam has got a huge role. I'll talk about it later on. And so many other things are there to talk about. And finally, the point is, if there is fatigue, listlessness, restlessness, I told you, have a good diet. My suggestion is, vaccine is a must, mandatory, inevitable, unavoidable, should be taken. That's it.
Right. Before I let you guys go, thank you so much for all the information you've given us, Dr. Amrita. It's quite concise and quite in-depth as well. So thank you so much. Before I go, Prashant, I want to ask you one thing. You have been working in the sidelines and yet in the heart of it. What is your biggest lesson from this pandemic?
I think for me, the biggest lesson was that I personally felt that working in the office is extremely important, and that everybody has to be in office every day. And I have certainly seen that that is not true. I mean, there is a lot of people can be productive working from home. I still feel that it's not going to be, that is not going to be the the way we work in the future, because obviously people want to interact, people want to have camaraderie with their colleagues, they want to go out for lunch with their colleagues, they want to have coffee. So you want to interact in person, you don't want to interact virtually with everyone, right? So I think long term we'll probably have a mix of work from home and work from office. But I think one thing is certainly proven, that work from home can be very productive. and probably more productive than working from office, in fact.
Yeah, true. Great. So everything on vaccination, as much of possibility on misinformation and what we need to do as well. So thank you so much,
Can I
Dr.
add a couple of lines more?
Please
It is
go ahead.
very
Please go ahead.
important. I feel that the country, the government hierarchy, the state governments, the corporate, the private sectors are all doing their jobs. The NGOs are doing a fantastic job. But what is the common man doing? My question is, आप क्या कर रहे हो और मैं क्या कर रही हूँ? Are we doing our bit other than playing the blame game? That is the question. So I have a message to give to everyone. And this is my main job in step 1. I've learned it from there and I want to give it back to all the speakers, all the people who are seeing us on this platform. I have a few do's and don'ts, which is a must. I have to say them. आजकल double mask government कहती है. Like this. Tight fitting. Not like this. Not like this. And not like this. Double mask is the order of the day. When you go out, it has to be a double mask. Right? When my daughter goes for a walk, she comes back with her mask, she throws her mask into her bathroom, into the bin, and she has her sabun pani, washing everything. But when she comes back, I wear a mask. वो कहीं से वायरस ला रही होगी भाई, आधा घंटा 1 घंटा तो कम से कम पहन के रखो, क्या फर्क पड़ता है? These things must be followed. Number 1. Number 2, if you have got corona in the house or you don't have corona in the house, you need to sanitize. You need to take a disinfectant and a sanitizer and do shoo on all the fomites, which is very important. Don't wait to get corona into the house and then start doing this. Touch wood, in my house for last 14 months, we are doing it every day, 3 times a day. सबको करना है, आपको भी करना है, आपको भी करना है, आपको भी करना है, सबको करना है. कोई घर में आता है उसको सैनिटाइजर दो, सामने रखो दरवाजे पे, और सोप एंड वाटर से आपने अपने जाके अच्छी तरह से हाथ धोना है. 15 से 20 सेकंड के लिए 15 से 20 बार. If somebody got you eggs and bread, pick it up under the table or over a table which you have earmarked. उसको रख दो. Don't touch it for 5 to 6 hours. Don't touch it. The fomites के ऊपर जो वो जिंदा रहते हैं, कई घंटों तक रहते हैं virus. He said, don't touch it, and then use a disinfectant to disinfect them, and then open them. Then take a veggie wash or take a मीठा सोडा वाला पानी बना के सब्जियों को धो, drain करो, फिर रखो, फिर after 4-5 hours of keeping separate, तब जाके मीठा सोडा वाले पानी में या किसी veggie wash में, उसके बाद जाके उनको सुखाओ. Then people who have got comorbid conditions, the people who got comorbid conditions, don't wait for corona to happen. ये करना जरूरी है. 400-500 रुपए 300-400 रुपए में आता है, सबको लेना जरूरी है. अपने लंग्स को एक्सपेंशन मोड में कोशिश करो, अपने लंग्स को एक्सपेंशन मोड में कोशिश करो, प्राणायाम करो, अनुलोम विलोम भस्त्रिका कपाल भाती करो. उससे आपके लंग्स के मसल्स थोड़े से स्ट्रांग होंगे. जिसको कोरोना है वो इससे भाप ले, दिन में 2 बार भाप ले. नमक के पानी के गरारे करो, नमक के पानी के गरारे करो. और मैंने वो रखा नहीं है स्ट्रॉ, पानी में स्ट्रॉ, पानी रखो, ग्लास में स्ट्रॉ रखो. स्ट्रॉ मेरा कहीं गायब हो गया है. स्ट्रॉ रख के बबल्स बनाओ. What will this help? Help in increasing the vital capacity of the lungs. Everybody should do it. Balloons ले लो, बच्चों को balloons दे दो, balloon फुलाएं. Why are we doing all this? We know last 4-5 weeks have been harrowing. Still hospitals में जगह नहीं, ICU में जगह नहीं, ICU में बेड नहीं, बेड के साथ वेंटिलेटर नहीं, वेंटिलेटर के साथ ऑक्सीजन सिलेंडर नहीं. अरे भाई, ईस्ट और वेस्ट भगवान का ऑक्सीजन बहुत है. खिड़कियां दरवाजे खोल के रखो, भगवान का ऑक्सीजन आने दो. खिड़कियां दरवाजे खोल के रखो, भगवान का ऑक्सीजन आने दो. एसी चलाना है तो चलाओ, फिर भी थोड़ी सी खिड़की खोल के रखो. ट्रांसमिशन ऑफ एयर होने दो. हमारे घर में हम एसी चलाते हैं, दरवाजा खोल के रखते हैं. कोई बात नहीं, थोड़ा बिजली का बिल ज्यादा आएगा, कोई बात नहीं. ये सब चीजें बतानी बहुत जरूरी थी. और एक बहुत जरूरी बात मैसेज और देनी. बीपी इंस्ट्रूमेंट लोग रखते हैं जिनके घर में बीपी होता है. बुखार हो बच्चों के लिए थर्मोमीटर रखते हैं, जिससे शुगर है वो ग्लूकोमीटर रखते हैं. आप ये रखोगे. ये क्या है? पल्स ऑक्सीमीटर. 1700-1800 रुपए का आता है. 2 पिज्जा, 2 लेज के पैकेट, 2 कोक की बोतल, 1700-1800 रुपए का बिल बनेगा. एक बार मत खरीदो, एक बार ये खरीदो. ये जान बचाएगा दोस्तों लोगों आपकी. ये जान बचाएगा. कैसे? इसको नापो. मिडिल फिंगर में रखो, एक 45 सेकंड्स के लिए देखो बटन लगा के, अगर 95 या 95 से ऊपर है तो कोई चिंता की बात नहीं, 95, 94, 93 आ रहा है, चिंता की बात है, परेशान होना है आपको, होना चाहिए. You have to be careful and conscious and cautious. Start doing a 6-minute test walk in the house, in the room. If you're positive, you remain inside the room. If you're positive but asymptomatic, inside the room. If you're not positive but you are a family member of a person who's positive, you will do it outside in the house. Even if you have no corona in the house, please keep one. This will save your life. If it is less than 93, 92, 91, call the buzzer, call the ambulance and rush. 3-4 weeks ago, we didn't even have a place in the hospital. Then that is the reason why, as Prashant was talking, oxygen concentrators, oxygen cylinders became a crowd to collect. Ab situation ठीक हो गई है, अच्छी हो रही है, लेकिन who's stopping you? Who's stopping you from buying this and checking your oxygen? Right. And one last but not the least, हम normally ऐसे सोते हैं, अब आपने ऐसे सोना. It's called prone sleeping. आपने नहीं सोना, आपके मामा, चाचा, ताया, भाई बहन जिनको गुड मॉर्निंग विश भेजते हो, सबको बोलो प्रोन स्लीपिंग करो. प्रोन स्लीपिंग करने से ऑक्सीजन अच्छी तरह से लंग्स में आता है और वो कैजुअलिटी नहीं होती जैसे लोगों की हुई है. इतना बोल के धन्यवाद.
Thank you so much. Thank you for all the information. Thank you so much. Thank you, Prashant. Thank you, Dr. Amita. Thank you, everyone, for joining us. And I think we